So how do you diagnose this then? Are there blood tests or other just things? Like how do you know? How do you know?
People usually in our practice, anybody with the double vision, they're sent
Mhm.
to me to look into, is it myasthenia? There are a lot of other causes of double vision, but that's how they usually present. Start with the eye muscles. They have droopy eyes. They could have double vision, and um, within the next 2 years, if they have a tendency to have a generalized myasthenia, as we're talking about affecting the speech and the swallowing, the respiratory, and the extremity, they will develop into that generalized myasthenia in the first 2 years, almost 80% of the patients.
Mhm.
So the diagnosis, when somebody comes with either fatigable weakness or eye muscle weakness, we do a blood test, the antibodies, acetylcholine receptor antibodies, MuSK antibodies, LRP4 antibodies. Then there's another group of neuromuscular junction disorder which affect the antibodies on the nerve end rather than the muscle end. So that is called the Lambert-Eaton myasthenic syndrome. So we check the antibodies for that. We also do blood tests to exclude other conditions like thyroid, other muscle diseases causing the weakness, and also do a CT of the chest because there's a gland called thymus gland that regulate the immune system, especially T cell mediated immune system. In patients with the myasthenia, you may see this gland may be enlarged, called a thymic hyperplasia, and a few percentage of people may have thymoma. So removing the thymus gland actually prevent a rapid progression of the myasthenia gravis.
Mhm.
So whether a patient has a thymic hyperplasia or thymoma, I do recommend if they do have myasthenia, we remove the thymic gland.
Mhm.
So we do get all this work of CT, and if everything is negative, this routine blood test and everything negative, your clinical suspicion is high for myasthenia, you would do a nerve study, EMG, electrodiagnostic study.
Mhm.
You try to mimic what in real life, because the fatigable weakness or the repetitive motion causing the weakness. So we actually do a repetitive nerve stimulation, stimulate that particular nerve to make the muscle move repeatedly to see if there is a classic pattern. We see almost a more than 10% decrement in that particular testing. So that is called RNS. That is not exclusively diagnostic of myasthenia, but in the correct clinical context, you could say that it's positive when you treat them for myasthenia. There is a group of patients, we did the RNS, it's inconclusive, or patient not able to tolerate the testing. We could do a single fiber EMG. You isolate one muscle fiber to see, is it working in synchronous with the rest of the muscles? Because of the blockage at the nerve muscle junction, the fibers can work in their own way. So there is a lot of variability. So we measure that, which is actually very typical for myasthenia or neuromuscular disorder, if that is abnormal. I do all that in my office,
Okay.
and it needs to be done by especially trained neuromuscular trained or clinical neurophysiology trained neurologists.